Okay, for the sake of time, let's get started. So, hello everyone. Before we start today, I want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day and on whose traditional territories all of our work takes place. My name is Autumn Sipus. I am the project coordinator with the Canadian Coalition for Green Healthcare. And on behalf of the coalition, Peach Health Ontario, the Canadian Association of Nurses for the Environment, and Ontario's Nurses for the Environment, I would like to welcome you to our second annual nursing webinar in honor of Nursing Week, How Canadian Nurses Are Advancing Planetary Health, from the local stage to the international arena. So throughout the webinar today, please use the chat function for any technical issues you may be experiencing. Use the Q&A function for any questions you have regarding the presentation, and our panelists will be answering questions at the end of our webinar today. We will also be recording this webinar, or we are recording this webinar, and the recording will be sent out to all registrants after the presentations today, and it will be available on our website and YouTube channel at a later time. I'm now going to hand things off to Maya to introduce today's speakers. Take it away, Maya.
Thank you so much, Autumn, and thank you, of course, to the Coalition for hosting us for Nurses Week once again. Happy Nurses Week to all you nurses out there. It's so wonderful to be here, and I'm so excited to introduce all of our speakers. The way that it's going to work is that we are going to go one by one, and as each speaker kind of gets ready to present their own piece, I'll introduce them as they come. So just as a kind of overview, we do have Rob Samulak, we have Terry Forrester, we have Ziru Lee and Vanessa Daquila as our guest speakers today, and they are going to talk about what they're doing to promote planetary health, all the way from the international stage to the local. All levels of action are so important, and it's great to see what nurses are doing at each of these different levels. So without further ado, I will ask Rob Samulak to get his slides ready while I introduce him. So Rob is a registered nurse working as a community visiting nurse in Ottawa. He's also worked in emergency medicine, surgery, public and camp nurse settings. He's the chair of the Ontario Nurses for the Environment with the Registered Nurses Association of Ontario, where he's working on various projects, including sustainable healthcare procurement policies, greening nursing schools, and policy response to various proposed legislation. He speaks to various groups about how the climate crisis is also a health crisis and has represented the RNAO at COP28 in Dubai. So take it away, Rob.
Thanks, Maya. Ooh, that went too fast. Yeah. Hi, everybody. Just to start, so I am the chair of the Ontario Nurses for the Environment, and we're an interest group of the Registered Nurses Association of Ontario. And for this event, the Registered Nurses Association of Ontario, RNAO, put in a draw prize for a free membership for RNAO for a year, and it's $100 value. So if you're interested in that, you can put your name in the chat, and there will be a draw at the end, and who will find out who our lucky winner is. So, climate change. The WHO has said that it's the biggest health threat facing humanity. They said this back in 2009. There's been some other studies that have shown that worldwide air pollution from burning fossil fuels is responsible for about 1 in 5 deaths globally, which is roughly the population of New York City. And you can see over here, this is a infographic on how climate change affects human health. So it starts with people who are already vulnerable. So due to various social determinants of health reasons, often climate change will magnify those a lot. It also puts a lot of strain on our healthcare system, both for capacity and for resilience. And it affects health outcomes in various ways, from injury and mortality from extreme weather events, heat-related illness, respiratory illness, such as when you from wildfire smoke or PM 2.5 air pollution from fossil fuels, zoonotic events, like epidemics coming from animals to humans because of closer human to animal exposure, vector-borne diseases like Lyme disease, malnutrition, and foodborne diseases like, well, when we have crop failures due to drought, among other things. All of these things exacerbate chronic diseases and mental health and psychosocial issues and have put incredible strain on our healthcare systems. Therefore, climate change is a big threat multiplier to our healthcare system. And as nurses, we should be advocating for it. People have warned about climate change for many decades. Over 100 years ago, Nobel Prize winning chemist, Svante Arrhenius, said that this was a strong possibility. In 1965, the White House was warned about it. And then fossil fuel companies from the 70s and onwards have had internal documents that have leaked that projected global warming, much like what we have today. So there's no secret. It's nothing new. It's just all of a sudden it's blowing up in our face. The fossil fuel companies, they knew about it and they used tactics to misinform the public so that they could continue to make a profit. A lot of this is very similar to the tobacco ads that used to happen and now have been banned. So fossil fuel companies like Enbridge, for instance, sponsors Winterlude in Ottawa, which is definitely a conflict of interest, among other things. To talk about all these things and to fight for them, RNAO sent me to COP28 in Dubai from November 2023 until December. So I was there for about 9-10 days. This is the United Nations Conference for Climate Change. Now it's kind of interesting. You think it's all about climate change? Well, over here, the president of COP, of the COP for this year is Sultan Ahmad Al Jaber, and he basically controls which way the talks, what direction they go in. And he's also the CEO of the Abu Dhabi National Oil Company. So one thing that was very common at this COP was there was a lot of fossil fuel influence there. And just like I was mentioning a moment ago, there's a lot of misinformation in them trying to protect their profits. And that's a lot of what we're up against. As nurses, we're the most trusted or one of the most trusted, depending on which study you look at, most trusted professions. And that's because our vested interest is human health. It's not about money and bottom line. Therefore, it's important for us to go and for us to speak about it. We have a really strong voice that we can use to speak out against all of these other for-profit voices. Now, it was huge. There were 100,000, there was about 100,000 people who participated in this COP. And it was the largest on record. The previous largest was in Glasgow 2 years before, and it was 40,000. So it was just a ginormous explosion of people. This here is the metro station in Dubai, just getting out of the metro to get in line to go into the COP grounds. So it took 2 hours just to stand in this line to get in for the first few days. So there was a lot of people there. And it was really claustrophobic. So that's kind of the feeling that we had. It was huge. It was the old World Expo grounds. It really felt like going to Disney World. And the size of it was actually larger than Disneyland in California. I had blood blisters on my feet, as I think most people did from walking around. So it was absolutely enormous. Again, talking about the fossil fuel influence, walking in, so on the left here, I have a picture from the metro in Dubai. Saskatchewan posted ads all over the metro. They also had billboards outside, and they had a ginormous billboard inside the Dubai International Airport coming in. And they were talking about quote unquote sustainability. However, they were also talking a lot about oil and gas. Saskatchewan also paid for a pavilion within the public green zone. And you can see here at one of the talks that they had, The premier of Saskatchewan, Scott Moe, he's on the right. There's two oil company CEOs, and as well as another vice president from another oil company. They were all on Canada badges, so they were official party overflow from Canada, government of Canada. This is at the Canada Pavilion, and Premier Danielle Smith from Alberta was there. I'm sure Maya loves this picture. Maya's from Alberta. It was really interesting. It was really canned speech, and she had canned questions from the audience. I was wearing this cool hat. I don't know if anyone can see my video here. It's an emissions cap. So people were wearing these. I got them from one of the other organizations that were there. And one of the big advocacy drives there was calling for an emissions cap on the oil and gas sector. So it's kind of just says emissions and it's a cap. But it was funny because when she looked over at me, she noted that there was a bunch of people in the audience who were wearing this cap. And she was a really smart person, but not good on a very I don't really agree with a lot of her policies, and there's a lot of misinformation that she was spouting. Within the grounds, there were official stunts that were taking place, and this was one of them. This was a bunch of Canadians, and they were calling to clean up the tar sands. So right on the international stage, Canada, while we were doing some positive things, it wasn't a rosy picture that was fully being painted. Okay. All right. This is at the WHO pavilion where they spoke about various health related things. Miles will find this one interesting. There was a talk on target setting for low carbon sustainable health systems. It was really hard, however, because there was talks everywhere and there was no good central logistics system to find out where all this stuff was happening. And on top of it, the things changed. The venues changed, times changed very unpredictably, and the logistics there were very challenging. And you spend a lot of time going in circles trying to find out where you would have the most impact. So I actually missed this talk. I was there right after, and I was kind of disappointed. However, there was some really good benefit from being there. It's a pay for access event. It is free to get in, but it costs a lot of money to go. And I got to speak with the minister for the environment minister, Stephen Guilbeault, and I went and I spoke about the campaign that RNAO is supporting, but it's a Cape and Cane-led campaign on banning fossil fuel ads so that we can stop the misinformation. And as you can see, I was wearing some scrubs and a stethoscope so that it was very obvious that I was a healthcare worker and a nurse. And that way it showed what I was bringing to the table and gave me that voice. But there was also Indigenous people wearing Indigenous Indigenous clothing. I got to speak with the Secretary General from the International Red Cross. This is what the main room looks like. I didn't spend much time in there. And this was a really cool thing that I participated in. This made it onto the front page of Reuters and AP. So on December 3rd, it was officially Health Day. And is it going to work? So we did a stunt, and during the stunt, it may not load. That's okay. It was a bunch of So we did a climate code on top using a globe, and this got a lot of attention because most people, they don't see the health connection for climate change. They think it's just about EVs and windmills, and they don't see the connection. And yet, going forward, the main thing about this is going to be how human suffering is caused by climate change. So originally, well, in the early 2000s, it was about the polar bear. In the 2010s, it was about windmills and electric vehicles. And from the 2020s and onwards, We're having heat waves and floodings and mass immigration from climate change, and it's a human health problem. It is a major health crisis. So that's what we're fighting there. That's what we're fighting for, and that's why I went. And this is the tallest tower in the world, and as you can see, it gets a little foggy at the top and that little hazy, and that's from all the air pollution that's there. So that's the end of my presentation, but that's just a little glimpse of what it was like.
Thank you, Rob. I will not comment about Danielle Smith. It's
Oh,
a
you love her,
touchy,
don't you, Maya?
it's a touchy subject. But thank you so much for your presentation about COP28. It seemed really interesting. I apologize for this future comment to any doctors in the crowd, but of course it's the nurse doing chest compressions. You know, everyone else is standing around watching and the nurse is doing the hard work. Just throwing that out there. So Rob, thank you so much. We're gonna move us along over to Terry. And so Terry uses she, her pronouns and advocates for planetary health through many roles. She is a nurse, an elected regional council member for the BC Nurses Union, and a city councillor for Prince Rupert. She's also the climate and planetary health contact for the Canadian Federation of Nurses Unions, in addition to work advocating with many social justice and animal rights causes. She recently completed her thesis, which explored applying an appreciative process to explore environmentally sustainable resource use in the Northern Health Authority. She graduated from a Master's of Arts in Leadership from Royal Roads University in fall of 2023, achieving honors distinction and receiving the Governor General's of Canada's Gold Medal. So Terry, I see your slides are up, and please take it away.
Thank you so much, Maya. I'm going to turn off my video. I'm got a little bit of Wi-Fi connectivity, just so that then I don't get kicked out or lag too much. Thank you so much. As Maya shared, my name is Terry Forster, and I use she, her, hers pronouns. I'd like to really quickly start by acknowledging that I'm joining from the stolen, traditional, and lived lands claimed by the Smalayak-speaking Tsimshian people off the north coast of British Columbia in Lahaine, which is the traditional Smalayak name for what has a colonial name of Prince Rupert, British Columbia. So I completed my master's research in 2023 on environmental sustainability and healthcare with a rural lens. As Maya shared, this was conducted with Northern Health Authority as my organizational partner. And the research asked the people who work in all roles of healthcare to bring forward their ideas for change and innovation to make healthcare more sustainable for everyone. A key portion of this focused on what small grassroots initiatives staff were already doing successfully or could do with only the resources they have on hand. So not really looking to see if we could get more money in a system that sometimes it can be challenging. Today's discussion is really going to focus on one aspect of that research and the findings and conclusions, which was conclusion 4, multi-use should be encouraged but may not be the best choice for all situations. So a finding from my anonymous survey was that staff wanted to see more multi-use products and facilities, which on the surface, we all would think that seems like a pretty easy recommendation. A context, however, that needs to be provided about rural healthcare and healthcare facilities is that many of our small towns in northern Canada, basically anywhere outside of a large urban area, many of us don't have laundry facilities, and we also don't often have recycling. So what does that practically mean? It means that laundry, soiled linens, multi-use items often have to be shipped out to a different town, sometimes several hundred kilometers away, or as it exists in some of my towns in my region, sometimes it has to be flown out or has to take a multi-hour ferry before being driven several hundred kilometers. This is actually really important to consider as I dive into the differences in the best choices for single versus multi-use, because it really does have a pretty big impact. So yes, I did actually just say that single use sometimes might be more environmentally friendly than multi-use, which seems incredibly funny to hear. Just a bit of background, we all know healthcare requires a lot of different types of PPE to protect staff and patients from the spread of disease. And during COVID-19, the use of PPE became extremely elevated with not only healthcare workers, but also the public. Globally, some research actually estimated that over 4 million tons of PPE was discarded during the pandemic year of 2020. A debate amongst a lot of different parties in healthcare in respect to single versus multi-use has actually resulted in a lot of conflicting research and findings. And it's really interesting if you dive deeply into who funded the research, whether or not there's an impact of industry in those findings. So one aspect of environmental sustainability is always water, and how is water used? So single use when creating a product is often comparable for single versus multi-use. However, multi-use uses way more water over their lifetime due to the need for sterilization and cleaning items, um, which is a context we also need to look at. It's not just about how long things take to decompose, but how are we looking at the total efficacy and environmental sustainability of an item? So if we're looking at multi-use or reusable gowns, they follow a multi-use approach, and so we often assume that they would be the better choice for the environment. Statistics vary a great deal on the length of safety for reusable gowns, ranging from 50 washes to over 70. A couple of studies said about 100. However, no matter which study I looked at, all of them agreed that efficacy for protection reduced with every single wash as the protectant barrier decreased. It also is important that there is a system available to wash and launder, sterilize these items, as well as to check and make sure that they actually have a barrier that remains intact. So in a lot of our rural areas, we don't actually have not only the laundry capabilities to check and make sure these are clean, but also we don't always have the equipment or the trained personnel to verify that the protective barrier is intact. So if we're looking through this list, you can see a significant amount of water and pesticides are used to create reusable gowns. So not only is the water being used to grow the cotton, which is a component of reusable gowns, but one gown laundered 50 times, so not even as many times as it's good for, is going to use over 400 liters of water plus detergents and pesticides. At the end of its usable life cycle, so when we get to that 50, 70, 100 uses and it's no longer good, where does it go? And unfortunately, at this point in time, they generally go into waste or refuse. When we look at studies to see how long these items will then take to decompose, we're looking at a 20 to 200 year cycle of decomposing. So then when we look at single or disposable gowns, typically these are made from petroleum-based non-biodegradable polymers that don't require water to make, but are made from multiple thin layers of non-woven and filtering layers of polypropylene. So while polypropylene is recyclable, studies document that less than 1% is recycled from municipal waste and even less from hospitals. There's several studies that demonstrate that gowns could be repurposed if recycled in areas such as concrete, furniture, and other plastic recycling. And there is now a BC-based company named Vitacor, which offers PPE recycling, as well as several companies across the world, where they're starting to take PPE, recycling it into pellets for use in industrial applications, such as the concrete I mentioned, exterior siding, different things like that. Currently, not a lot of health authorities actually recycle their PPE. It tends to be a bit limited to smaller industries. My local hair salon will recycle PPE, for instance. This type, when it does get disposed, is much smaller and lighter than the cotton blend of the multi-use gowns, but takes more than double to decompose, up to 400 years. So that's pretty depressing. Neither one is really the best option for everybody. But what could we start doing? And that's where we really need to start looking into repurposing circular economies, and different options. So single use in rural areas with no laundry facilities unfortunately remain the surprising best choice for that situation. But pushes to move to recycling single use PPE really need to happen with a lot more positive and thoughtful intent. An option that bears additional further exploration, and something that I personally am excited to be starting to really dive deep into and look at, is opportunities to repurpose the multi-use products that no longer meet safety requirements. So as you can see from this slide, um, a lot of textiles in the world end up being taken to the dump. Clothing is no longer really used the way it could be. People buy things because they're cheap, they're not made well, they break down, and they simply go into the garbage dump. Um, so if we could take some of our multi-use gowns and start turning them into other things, such as hospital scrubs, patient gowns, clothing, or other things that don't need that protective barrier, we might be able to get some better uses and start looking towards a more sustainable economy. I'm hopeful that all of you know about the amazing work that CFNU and Kane did in creating a nursing toolkit for planetary health. And I do highly recommend everybody take some time to get to look through that great document that really helps people start having conversations about what they could do today in their work site. So some final thoughts: changes to improve the healthcare system's environmentally sustainability is really quite necessary. Each step towards environmental sustainability in healthcare brings hope for the future. And ultimately, no idea is perfect. There's always conflicting and different thoughts, um, but finding opportunities to try and be more innovative is still positive. And that's it. Thank you so much.
Thank you so much, Terry, and thanks for sharing out some of the good work that's happening over at Kane. That the CFNU and Kane have worked together on that toolkit, which is awesome to see that it's making its rounds. Okay, so from Terry, we're going to go over to Ziru. And Ziru, if you want to get your slides ready while I introduce you, that'd be great. Ziru Lee is a planetary health research nurse with the Nursing and Allied Health Research and Knowledge Translation Department. Her clinical experience includes pediatric oncology, hematology, and hematopoietic stem cell transplant. Zira, you can correct me in a minute. She also has experience coordinating community, palliative, and respite care for children with medical complexities. Zira is passionate about exploring the interconnectedness of human and planetary health to nursing practice. Her role as a planetary health research nurse will support frontline nurses at BC Cancer to implement sustainability initiatives in their clinical settings. Ziru's goal is to promote human health through advocating for the health of our planet. And so Ziru, take it away. If you're talking, you're on mute.
Thanks, Maya. I can't figure out how to get my video on. I don't know what happened. Oh, there. Okay. Sorry, guys. Thanks, Maya. And I apologize for that bio. I just pulled it off something that was already written. And I apologize for that word, hematopoietic stem cell transplant. So hi, everyone. I'm excited to celebrate Nurses Week here with everyone and celebrate the work that nurses are doing to promote planetary health. As Maya mentioned, my name is Siru. I'm a planetary health research nurse at BC Cancer. And for my talk, I will be sharing details about BC Cancer's Planetary Health Nursing Internship Program. So I will begin with a moment to reflect on the lands from which our internship program takes place. BC Cancer operates on the traditional unceded territories of Indigenous nations throughout British Columbia. I am calling in today from the never surrendered lands of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations. I am ever grateful for their stewardship of these lands and for the traditional knowledge and wisdom that guide our sustainability transition. The Provincial Health Services Authority was gifted with 6 teachings by Musqueam knowledge keeper Sulkson. These teachings are Coast Salish law. They ground us and offer guidance on how we may do our best as human beings and show up in relation to one another. And they exemplify how Indigenous traditional knowledge can help restore our connection within nature in order to advance planetary health. If you'd like to learn more about these teachings, there is a recorded webinar on PHSA's YouTube channel. Here's a photo of our team. We are the Nursing and Allied Health Research and KT team at BC Cancer. We promote interprofessional research and knowledge mobilization to drive improvements in care. And this program, our internship program, would not be possible without support and contributions from the Canadian Association of Nurses for the Environment, Health Quality BC, Cascades, and our 25 speakers and panelists. So some background on how and why we have the Planetary Health Nursing Internship Program. Rob has already touched on this, and I'll keep this brief. So this is a graphic from a 2023 Lancet publication by Drs. Courtney Howard and Dr. Andrea McNeil. From the bottom up, we see that the ecological determinants of health provide the basis for our societies to function and for us to be healthy and well. Disruptions to our natural environments undermine the social and structural determinants of health, which increases burden of care on our healthcare systems and workforce, which all have direct and indirect impacts on human health. And the motivation for this program really arose from the increasing awareness that we need to address healthcare's environmental footprint, which is contributing to the triple planetary crisis. In the 2022 Lancet Countdown Climate Change and Health, Canada's per capita, which is average per person health sector emissions, ranked second highest globally. There are many nations with lower emitting health systems that have equivalent or even higher life expectancy than Canada, showing us that it is possible to create a more environmentally sustainable health system and increase quality of care at the same time. The good news is that there is a lot of room for us to improve. So most of you are likely familiar with what the triple planetary crisis means. I will just make the distinction that climate change is just one of several concerns within the broader picture of our global environmental crisis, and climate change and planetary health are not interchangeable terms. Of all the planetary health concerns, climate change is the one that gets the most attention, and climate change and air pollution does have health implications on cancer incidence and outcomes. So here are some examples of how climate change impacts oncology care. The International Agency for Research on Cancer has classified outdoor air pollution as a group 1 carcinogen. Increasing evidence suggests that the association may not be limited to lung cancer, but also cancer of other sites. Long-term exposure to wildfires has been suggested to increase the incidence of lung cancer and brain tumors. Occupational heat exposure, which is exacerbated by climate change, is associated with several cancers such as female breast cancer. The climate change-induced ozone depletion led to increasing ultraviolet radiation exposure, which will lead to increased risks of melanoma and other skin cancers. One of the significant ways that climate change can affect patients is by making it more difficult for them to receive care. Extreme weather events can disrupt patients' ability to receive cancer diagnosis and life-saving treatments. People living with cancer are already in a vulnerable state of decreased capacity. They are often immunocompromised and can have impaired thermoregulatory function, which puts them at higher risk for decompensating in extreme temperatures like heat waves. And from an environmental justice perspective, those who have lower incomes have higher incidences of cancer and poorer survival rates. Cancer mortality is higher in rural areas with higher rates of poverty, and climate change will only widen this health inequity gap. BC Cancer's vision is a world free from cancer. So to decrease the incidence of cancer, planetary health must be recognized as a priority, and we must transition to more environmentally sustainable healthcare practices. Of course, all allied health professionals have an important role to play in our sustainability transition. We are starting with nurses because nurses are embedded in clinical practice. We work at the intersection of our multidisciplinary teams, and we deliver resource-intensive care. Nursing is the largest group of health professionals in Canada, and we are also the largest profession delivering, influencing, and leading healthcare globally. Nurses are consistently a trusted voice on health in public opinion polls from around the globe, and in Canada, we rank second behind firefighters. Nurses used to rank first until a few years ago, since forest fires have taken over our summers in Canada. The planetary health crisis is a human health crisis, and nurses have a part to play. And so our internship program is the first of its kind that we know of, giving frontline nurses protected time to learn about planetary health and various strategies to bring about change in their clinical settings. This internship is 12 weeks long, and we have multiple cohorts per year running back to back. In 2024, we will have 18 nurses complete our internship, and starting from 2025, there will be 24 spots per year. Our curriculum development is guided by the Planetary Health Alliance's education framework. This framework considers 5 foundational domains that are believed to comprise the essence of planetary health. At the very core and interrelating to each and every other domain is interconnection within nature. The recognition that human health is intricately tied to the thriving state of our natural systems and the responsible management of these ecosystems. This is a worldview informed by Indigenous and other traditional knowledge systems around the world that still maintain reciprocal and symbiotic relationships with nature. We recognize there are many ways to bring about change, and we give our nurses a variety of training to equip them as change makers. They receive quality improvement and KT training, they learn and utilize change management, and they build leadership skills to discern where to focus their energy. We have also a public narrative workshop to develop storytelling skills so that they can engage and motivate others to join their cause to generate that buy-in from their teams to support their change projects. And we ask our nurses to prioritize projects at the top of this waste hierarchy. This one is from Healthcare Without Harm. Projects that focus on rethinking and reducing will have the most environmental impact on conserving resources and minimizing waste. Here's a project from one of our interns, Bridie Davey. She is a clinical nurse leader at our Prince George Cancer Center. She's looking at phasing out the culture of using disposable blue pads for IV starts. Currently, patients' arms are warmed by a wet, warm towel that's covered with this disposable waterproof pad, and that means that for every IV start, there is a blue pad disposed into the landfill. What Bridie has found through her review of the evidence is that this is not best practice. Studies show that dry heat is associated with 15% more successful first IV cannulation attempts. So although we can look at replacing single-use pads with a reusable option, we can completely rethink the need for this practice. This is a poster Bridie made to put up around the clinical areas to inform our patients of our efforts to reduce healthcare's environmental footprint. And she came up with the catchy "Be Rad, Avoid the Pad" slogan. It's an effort to engage our patients and involve them in our sustainability transition. Here are some testimonials. Our nurses are learning to communicate how climate change impacts human health to their peers. They feel empowered to make a difference and are learning to leverage and amplify their trusted voices as health professionals to advocate for planetary health. So what are our hopes and dreams? We hope our nurses will develop communities of practice to further drive change. We are a provincial program with 6 regional centers, and we hope this network of planetary health nurses will help spread sustainable change throughout the province and beyond. And actually, participants from our first cohort have already discussed creating an alumni network at the end of their internship to stay connected. Through this program, our nurses develop various career laddering skills, and we hope that as they advance into leadership roles within this organization, they will maintain a sustainability lens. Nurses as frontline clinicians talk to patients. We hope that by communicating our organization's dedication to environmental sustainability to our patients and communities, we support this movement building for social change. And finally, our research team hopes to contribute to that global community of evidence on the planetary health crisis, its impact on human health and cancer incidence and outcomes from an environmental justice perspective, and the crucial role of nurses and allied health professionals in our sustainability transition. And that concludes this overview of our internship program. If you're interested, this QR code will take you directly to our website, and my email is here if you'd like to get in touch. And happy National Nurses Week.
Thank you so much for that, Ziru. I must say, over at Kane, it's been so wonderful to support you in your work and seeing this program really come together. You're doing amazing stuff over there. It's been so cool to see. So anyway, with that, we are going to move on to our final panelist, Vanessa D'Aquila. And Vanessa is the recipient of the 2021 Stephanie Davis Waste Reduction Award and Scholarship. She formed a pediatric intensive care unit green team in 2018 in order to limit waste consumption and advocate for sustainable initiatives across her institution. During her master's in nursing graduate degree at McGill University, she helped form McGill's Nurses for Planetary Health group. And she created a vice president of sustainability role while serving as the Nursing Graduate Student Association president from 2021 to 2022. She encourages all healthcare professionals to use their voice and social influences to promote effective changes regarding planetary health into their immediate and global environments. As the current assistant nurse manager at Shriners Hospital for Children, Canada, she recognizes how nurses' roles in addressing climate change could also impact the health of our patients and all of us as part of the public. In 2020, her work received encouragement from the OIIQ. I dare not say the name because my lack of French accent and French understanding would murder it. So Vanessa, if you could unmute and just start, your presentation, I'm really excited to hear what you've got.
Perfect. Thank you so much. Merci. C'est l'Ordre des infirmières du Québec. Not a problem. I'm sorry, it was a little bit of a long introduction. I don't want to forget before starting my presentation, just sharing these climate-wise slides. Maybe some are familiar with it. Your presentation, Zuru, made me think that this could be a unique resource for nurse educators, nurse managers, those who are teaching nursing students, a really unique way to integrate this topic of planetary health and climate change into presentations with different topics, cardiology, dermatology, etc. You're seeing my slides okay? Perfect. So thank you so much for the invitation to present. I'm so excited to be here. I did the majority of my studies at McGill University, so I wanted to acknowledge that McGill University is on a land which has long served as a site of meeting and exchange amongst Indigenous peoples, including the Haudenosaunee and Anishinaabe nations. And we acknowledge and thank the diverse Indigenous peoples whose presence marks this territory on which peoples of the world now gather. So really briefly, I wanted to touch base on healthcare's climate footprint, our health environment approach, focus on the green team that I helped promote in the pediatric intensive care unit at the Montreal Children's Hospital, and some key messages. So I want to state that I have no conflict of interests. When we discuss healthcare's climate footprint, we know that 5% of global greenhouse gas emissions is related to our healthcare system. And if healthcare was a country, it would be the world's 5th largest contributor to greenhouse gas emissions. And we have this image from Healthcare's Climate Footprint, Healthcare Without Harm. It's in French, but it goes to describe here the energy use within our institutions. We have anesthetic gases, production or the serving of meat, transport of food, the different transport methods to get to the hospital, and the displacements of employees as well. And when we're talking about this health environment approach, like the previous panelists were discussing, it's to change and improve the lives of our children, our public, our whole population. And the human health and environment are intrinsically connected. And in this sense, the healthcare system, our healthcare professionals must set an example for this. So some next steps, we want to look at a commitment and diagnose some of the areas that we could be improving, focus on action planning, implementation and evaluation, education, communication, awareness and mobilization, and of course, trying to link this with our 17 Sustainable Development Goals. So why make a green team? I had heard of this topic, oh my goodness, probably in 2016, and I was so motivated by the topic. And then I started to do research regarding this within my master's degree. And I was noticing that the term green team could be discussed in a general sense. So to say you have an upstream approach where you have leaders within a sustainable development committee, all the way to a grassroots initiative, which is what I'm going to be talking to you about. And with that link is employee satisfaction. So we have espoused values on our intranet, on our hospital website, and then we have enacted values. So what are we seeing on a day-to-day basis? And does that align with our personal values in terms of planetary health, for the example? And with that, we want to be linking with our employee satisfaction. Now, I went to my nurse manager, and this is a great angle to take as well when you're talking to directors of part of your institution. But if you're going to be linking initiatives with cost reduction and savings, then automatically you have their attention. So it could be limiting paper consumption, limiting waste, limiting buying in bulk and seeing with proper purchasing what would be necessary and what isn't necessary to be purchasing. And obviously, the goal is the environmental impact, which is all over social media globally, an issue that we want to be addressing together. So I really wanted to feel like we could make an impact as bedside nurses. And so we formed this interprofessional working group with a green team with a short-term goal initially of promoting less waste consumption on our unit. And the long-term goal of promoting sustainable, initially it was recycling initiatives across the institution, alongside this individual with a very long title, the McGill University Health Center representative for planning, programming, and research, etc. And she's a member of the Sustainable Development Committee within the McGill University Health Center. But we grew to recognize that our interdisciplinary team had such amazing ideas, and we really wanted to make sure that we were incorporating a multidisciplinary lens. So we got some of our PICU fellows interested, our infection prevention control team, our respiratory therapists, our patient care attendants, our nurse manager, of course, before starting the whole process, and housekeeping as well. So we were looking from a bottom up and a top down approach with also members of the Sustainable Development Committee. And we realized quickly that the hospital environment had certain barriers that were already present and certain facilitators. So some barriers were that the hospital environments in general encourage this sense of numbness. So we could walk into our stock rooms as nurses, and luckily we have an abundance of materials. We could say, oh, I'm doing a dressing change. I'm going to need these many sterile gauzes, this much salt water, etc. And then you can enter into the room and then realize, oh my goodness, I have way too many materials. And how could we think of that moving forward to eliminate the waste that's being brought in the room if you're going to have to dispose of the materials that are contaminated? Another barrier was this temporal justification. We hear this all the time. I have no time. I'm very busy with everything else that I have on my to-do list. This moral offset. So, this is an interesting one, but I'm doing enough good being a nurse or a doctor at the moment or another healthcare professional. So someone else will do it, diffusion of responsibility. I don't have time to think of the planet right now. I'm just at work. And groupthink when we're not challenging the status quo. Some facilitators are aligning with our allied healthcare professionals, environment restructuring, increasing education, and slowly changing the social context. I won't go into too much of the Combi model here, but we're looking at changing behaviors of individuals. So for example, recycling initiatives. If we're not providing proper bins for recycling with proper informational signage, we're not allowing the optimal capability of the individual to change their behavior, nor the opportunity to recognize what goes where. And there's automatic and reflective motivation that we want to be thinking about as well. So how to get started, you can look within your own teams, see who's motivated, look at a needs assessment, create a team mission statement, prioritize, maintain momentum, generate goals, and communicate, educate, and celebrate. But recognize that, I know when I had started, my nurse manager said, one thing at a time. There's a concept of wanting to create one drop in the ocean to create a tsunami of change. But if you start with a tsunami, you're going to get overwhelmed really quickly. So really focus on what priorities are within your unit or your institution. So for us, we realized that there was opportunity to enhance the informational signage when it came to products that we use every day. So the thin, thick cardboard boxes and the transparent plastics, which all our medications come in. So we created dedicated recycling zones, informational signage across the unit to really show where could we be collecting this material in a way that isn't encouraging contamination. So a mixture of multiple products in the bin that will just not be proper for recycling. And educate the team that all materials are compacted in our recycling center. So if we do it properly, we could optimize the process. Limiting paper consumption, battery recycling, our oxygen saturation probes are recyclable as well. pilot project started at NUHC to also be using droplet contact masks to be recycled into other products. And looking at sustainability. So what are some benefits? How do we make this a part of our routine? And how is the initiative continuing to develop? So we put reminders around our unit. We call them Green Team reminders. We have updates on our social platforms, using benefits to go through the different bins, and really creating this context of our intranet, sharing information with our Sustainable Development Committee, which is accessible for all employees. There should be probably more green teams on the map. I know this was expanding, an initiative by greenhealthcare.ca. And really looking at how do we avoid potentially single-use products, given what we were also discussing earlier in the presentation, but do we have the opportunity to use all products before their expiration date? And if not, then maybe we should be rediscussing smarter purchasing and reusables and avoiding at the first place. So I'm there for time, but I'll just mention really quickly, when we're thinking about any institution, we want to be looking at what are our direct emissions and what is a result of our direct emissions. So what are we burning in scope 1? What's within our own facilities that we could be controlling? What are we purchasing? What are we buying indirectly through purchase energy in scope 2? And in scope 3, which is the largest consideration here with multiple different, indirect emissions, what's beyond? And that's obviously the most difficult one to measure, but that's something that we should be looking at measuring so that we could be making the impact less on our greenhouse gas emissions. So thank you so much. I'm gonna be happy to share my slides for some key messages. And I thank you so much. If there's any questions en anglais or en français, I'm open to hearing them.
Thank you so much, Vanessa. It's so great to hear what you're doing and all the areas that you're tackling sustainability in. It's really cool. So now is sort of the question and answer period. These do tend to go a little bit over the hour mark. So if you are able to stay, that's great. But please, if you could just throw your questions in the chat. While we're waiting for some of those to roll in, I'm going to kick it over to Autumn to just announce the winner for the RNAO draw that we are having today. And yeah, feel free to use the chat and ask our panelists anything.
Yeah, while you guys are putting your questions in the Q&A, I will start the draw. And I'm just going to read out the names that I have so far. So just in case I missed anyone, you guys can re-put your name in the chat or put up your hand, whatever you'd like. Otherwise, I will just go with these 4 names I have. So Cara Moore, Noel, Nicole Saunier Ho, Deanna Sterling, and Deanna, I'm just going to say Deanna D because I just can't butcher your last name. I'm so sorry. So yeah, anybody else wants to enter the draw, please put your names in now. It's your last chance. Okay, well, I'm going to go ahead and do the draw then. I have my cute little pot here, clean.
This is full transparency.
Full transparency. Okay. Deanna Sterling, winner. Woo! So I will get your email from the registration and I will connect you with Rob to award you your membership. Congratulations.
Thank you, Autumn. Thank you, RNAO. Rob, let them know we're very grateful. And we do have a question that's come in through the Q&A section here. And this comes from someone who's also really interested in starting a green team. So Vanessa, maybe this is for you. How did you advertise and build momentum for the startup process?
Perfect. So thank you so much, Bridget, for that question. It's so exciting that you guys are also talking about forming a green team. I would first start with our managers and getting the permission to really see if they're on board and what lens they think is a priority for your unit, let's say, if it's a specific unit you're thinking about. And my next step would really be to reach out to any form of sustainable development committee or upstream approach with the directors, or those who are really within housekeeping services, those who could get you the accurate information about what is already taking place within your organization. Because I've noticed that a lot of the work could be put in, but you don't want to be remaking the wheel. So you want to be aligning what's already taking place and optimizing those processes, because oftentimes they're not optimized. And then once you have that start point of creating that education platform via very specific, accurate details, then you could see within your own unit what are some practices that we could be doing that are less wasteful. Or, like we had recycling, I didn't mention this, but recycling of cans very far off the unit. So that's not increasing our capability and our motivation to leave your unit and then go recycle your cans. So we created, we got these cans or consigne action, I don't know if it's the same across, but dedicated bins in our lounge. And now those are filling to the top completely, that it's gone up to the Sustainable Development Committee and it's being put around the institution, because there's a big profit with that they realized was missing. So once you're in alignment with all that, it's a great start. And reach out to your interdisciplinary team for sure to see what ideas come up via their professional opinions to pharmacy as well. Yeah.
Thank you, Vanessa. I did see Miles's question, but maybe we'll leave that for the end. And I saw a lovely comment from Aggie in the chat as well. Rob asked the question in French. I'm not sure how to say it. I'm so sorry. If you'd like to ask your question, Rob, you definitely can. I'm not I'm not going to attempt it.
Miguel, est-ce que les choses recyclées sont vraiment recyclées?
C'est une très bonne question, Rob. Merci pour demander. C'est sûr que la plupart de mes études étaient à McGill, puis j'ai commencé des initiatives avec l'École des infirmières. Puis on a plein de différents bas sur the bins qui sont indiqués que oui, c'est en train d'être recyclé. Mais la plupart de mes études, mes projets étaient à l'ECUSUM, le Centre Université de Santé McGill. Alors, je ne peux pas commenter avec 100% de détails pour McGill spécifiquement, mais on peut parler plus après ça pour avoir la bonne réponse pour McGill. Yeah. Merci.
Thank you for that. And, I'm just looking at the time, knowing that we are going to be going over. Maybe we will go to Miles's question. And, Terry, maybe if you want to start us with kind of what's your big take-home message?
Sure, thank you. My big take-home message is don't be discouraged. It might seem like something is not the most environmentally sustainable option, but when you dig deep, it might actually be good. So long as you're working forward with positive intent and doing your best, that's what matters. Those are the ripples that make change in the entire system.
Thank you, Terry. Ziru, I'm going to ask you a question that came in from the Q&A section, and then you can also follow it up with your take-home message. But the question is this: can you tell us more about the internship? Like, how do we apply for the internship and how do we stand out as an applicant? And then follow that up with your take-home message.
Yeah, for sure. Thanks, Maya. So in order to apply for the internship program, it's actually only open to BC Cancer employees. And you have to actually be an employee at one of the regional cancer centers, because we do have oncology sites all throughout the province. So there's 6 BC Cancer regional centers. And in that way, if anyone wants to take part in this internship program, you could come and apply and work at BC Cancer. And the application process right now is just a 1-paragraph expression of interest. And we do look at environmental potential for environmental impact, and then also feasibility of the project when we're evaluating our expression of interest. And I think my one take-home message, having gone around the units and really socializing this internship program, and just recognizing that I think in our profession and in our healthcare facilities, planetary health is still not a term that many people understand, and really are drawing that connection between like human health, the health of the planet, and like as healthcare providers, our role that we have to play in this. And so I think it's just talking to people and you guys, everyone that's participating in this webinar is interested in this topic and probably knows more than like people in your clinical settings if you do work in a clinical setting. So talk to people about it.
Thank you, Zero. And then Rob, why don't we go for you for your take home?
So this is a real healthcare crisis. Nurses have to be on the front line advocating for it. It doesn't matter where you advocate. If you feel passionate about something, advocate in that direction. But we must get all the nurses on board and advocating for this. So wherever you feel strongly motivated, go for that, but do something.
Thank you, Rob. And then Vanessa, how about you?
Right. So hospital waste consumption needs to be addressed. We're really overall promoting too much waste and too much greenhouse gas emissions that aren't necessarily being measured in the same way across different institutions. So it's quite hard to compare. If you're looking into establishing a green team, make it a multidisciplinary approach, consider behavior change theories if you're trying to motivate the team, and really look at upstream approaches to connect with your sustainable development committee, et cetera. And don't get discouraged. I like that one because it could be a long road, but if you stay motivated within it and you align yourself with motivated individuals, then it could happen.
Thank you. And I think perhaps we lost Terry. We did admittedly go past the hour, so maybe she had to leave. But, you know, I am not a panelist, but I will also give you a take-home message as president of the Canadian Association of Nurses for the Environment. You know, I want to remind all of you, nurses and non-nurses, nurses are essential actors in advocating for planetary health. It is in our ethical mandate and duty to do so. When we promote the health of the planet, we are promoting the health of humanity. And ultimately, you know, I would even go so far as to say, you know, don't get discouraged, but have hope. You know, we are making a difference. This is a small sampling of all the amazing things that nurses are doing out there. And I am so incredibly proud to be a nurse, to know these nurses, and to continue to advance the profession in this way. So join Kane, join One, join all the, you know, the environmental nurses that you can, and keep talking about it and make it relevant for people, because this is the most important problem of our time, in my opinion. So thank you so much for joining us. Happy Nurses Week. I hope you all get raises. I hope no one gives you pizza and then tells you to work overtime. That's what we need.
Thank you so much, Maya, and thank you everyone for another great edition of our nursing webinars. Thank you to all our attendees. This was fantastic. Take care, everyone. Bye.